welcome everyone to the first online live pharmacy medication instructional program. Before we get started, I'm going to read this disclaimer that you see on your screen. The Pharmacist Virtual Learning Experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendation or request of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Thanks again, everyone, and welcome again to the Pharmacist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your home. Pharmacist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be human growth hormone, Ovidrel, and Synera, including interactive question and answers throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be part of the discussion by sharing your question in either format. We are joined by various amazing healthcare professionals each week from across the nation to provide you with real-world experience, just as if you were sitting across the table from them at your clinic. Today, we are joined by Wanda Hofgesang, and thank you again for your time and interest this evening. And now I'm going to turn it over to Wanda.
Hi, good evening, everybody, and good evening, Morgan. Thanks for the great introduction. I'm excited to be here with everybody at the Virtual Learning Experience. It's a great forum and a great platform for patients to see these medications and be able to have a live nurse. And those of us that do this have our live nurses with present experience. I've been a nurse for a long time, since 1994. I think I was a change of career nurse when I went back to school for nursing, and I love being a nurse. And most of my experience has been in reproductive medicine and fertility. So it's been a long journey for me to see how things have progressed throughout the years. So this is a great part of what I think is awesome in terms of helping you learn your different medications. Teaching has always been a big part of all of us nurses, including Morgan, when we're teaching our patients when it gets to these cycles and the medications, and it can seem overwhelming. So the goal tonight is to be able to simplify as best as we can, showing you medication mixing, administration, and then being able to allow you to have time to answer questions live with me and Morgan as well to compliment me and answer anything that she might hear as well here tonight. You'll find that what we said we were going to do is 3 medications this evening: human growth hormone, Synera patches, and Ovidrel medication. So all 3 of these medications will be something that we review. What I will say, when you get to the question and answer part of it, all questions should be kept at more of a general question, because anything that's very specific for you, absolutely you should reach out to your fertility healthcare provider team, nurse and doctor, to get any specifics that are relative for your cycle. That's what's really key. What I always say is that our goal here tonight is for you to become a pro at your medications, for you to take comfort and feel more empowered with how to mix a medication and how to administer that. Then that's really all of us. Our goal is to help you feel comfortable with these medications as best as possible. The other thing to know is the videos from tonight will be able to be seen via the My Mandel's Pharmacy website, which is always great, because I think, like anything, practice, practice, practice. And the more you see something, the more comfortable you'll get with that. So the nice thing is there's a big library there of the virtual learning experiences like this evening, as well as all the different medications. And that's just great to know that that's always there for you to look at. So tonight's not the only time that you have to watch this. You can replay those videos over and over. One of the things I'll say before we get started with the human growth hormone video is just, I think a big thing is when you receive your medications from a pharmacy like Mandel's, real important is to organize yourself. So it's just good to open that box of medications, take a look at it. You'll find that you may have more than one item. For example, you might have more than one box of Synera patches or human growth hormone, whatever it may be. So what you want to know is it's good to organize like items. Also, on any of the medications, there's always how to store that medication. If you ever are wondering, your medication usually will say how it's to be stored. Some of them are refrigerated, some of them are room temperature. So I just think that's a really good idea to take a look at that box when it arrives, not necessarily get nervous to open it, be able to organize yourself before your cycle. And that way there you can feel a little more comfortable. There's a lot of different medications in there, but it doesn't mean all of them are happening at the same time. Your healthcare provider, clinic, and nurse will help you in breaking down which medications are at what point within the cycle. So that's just really my key to getting started. What we will do is we're going to take a look at that first video, which is the human growth hormone. And human growth hormone can be a part of patient cycles for the follicular recruitment. So I won't want to give away too much of the information because I want you to be able to see the video. But for select cases, the human growth hormone is something that is used during that beginning part of the phase leading up to an egg retrieval, helping the body with the recruitment of the follicles/eggs. So the idea behind that is it'll be in the first part of that cycle before the egg retrieval. So Morgan, if you're ready, we'll go right to it and take a look at that video and then come back here for any questions that you might have. Hi everyone, the following video for your medication experience through My Mandel's virtual learning experience is for human growth hormone. Human growth hormone will be possibly a part of your fertility cycle. Your clinic will determine for you based on your previous gynecological history, or if you've done any other cycles of fertility treatments, if this is a part of your cycle. It works in conjunction with some of the other medications that may be a part of your cycle. So it's not a one-size-fits-all that everyone does human growth hormone, but it absolutely could be a part of your cycle. So the purpose of this video is to help show you how to mix and administer human growth hormone. When you work with your fertility clinic, they will, of course, be working with a pharmacy like Mandel's that'll be shipping you the medication. Human growth hormone might come under another name, such as Omnitrope is another one of the names that you might see this in the packaging when you receive it. As always, there will be instructions on how to store the medication. Usually once you receive this medication, you can store it at room temperature. It is a mixing medication, so you'll find that I'll mention that once you mix the product, you'll have a little remaining of that mixture to use for a following injection, and that part of the mixture we will remind you to put that in the refrigerator. So there will always be where you'll be guided how to mix, how to administer, and what dosage you're taking. All of that specifics comes from your clinic. This is just a nice general video to help you along once you do get that medication and you're ready to get started. What you'll find when you get the medication, the supplies you'll be needing are, usually you'll have 2 vials. One will contain a powder or a pellet in the bottom of that vial. The other vial that you'll have will have what looks like sterile water, just a water solution, but it is a sterile water solution. So these 2 vials are what you'll need in order to do your mixing. You may receive multiple vials from the pharmacy, and that's determined by your clinic. Depending upon how many days they project that you'll need the medication and your daily dosage, you will be ordered the amount of product that you need. And certainly if you ever need to get more, the clinic will advise you how to contact the pharmacy to potentially get a refill of that. So you need your powder vial and your water vial. As far as syringes go, what will be sent to you is you might have this 3 cc, 3 milliliter syringe sent to you, and it may have a longer needle on that. This is typically the mixing needle that you'll be using for the HGH, or human growth hormone. The other needle and syringe that you might also receive may have an orange cap to it. These are typically referred to as insulin syringes because there's a very small measuring thin barrel needle, barrel syringe. And so what you'll find is you're taking a very small amount of liquid amount of the medication. And so you'll need this type of syringe in order to inject. HGH is what we call subcutaneous injection. So the needle that you'll be using for injecting is going to be rather tiny, usually a ½ inch in length. And the area of location will be confirmed to inject, but oftentimes at most clinics for this type of shot, you'll be using either the lower belly or possibly the upper top, upper side, outer thigh area. These areas have some nice fatty tissue, and that's the type of injection this is for absorption that works best with the medication. So your first step with any mixing and part of this mixing with your medication step is it's always a good idea to wash your hands. Working with the medication isn't sterile technique, but it certainly is a nice clean technique. So washing your hands before you do the mixing is a great way to get started. The next step is have available, and you might get these from the pharmacy. These are little alcohol pads, but you may also have a bottle of rubbing alcohol and a cotton ball that can be used to help administer when you put this into the skin, or also you'll see that I use it on top of the vial when before I put the needle into the vial. So I'm taking one of these and opening it up. And my next step is going to be to uncap each of the vials, and I'll hear a little snap with that. And after I hear the little snap and I've taken the cap off, I'll just rub the top a little bit with alcohol. Just in case I did not wash my hands, it's a good idea you're cleaning the top of that vial. Even though usually it's sterile under the top, it's just a good extra measure to take to reassure that everything is good to go. The first syringe that we are going to use is that syringe that has the longer needle. Remember, for the HGH, this is a mixing needle, so I don't want you to worry about the size of that needle and syringe. So you open that up. Sometimes it's not a bad idea to just make sure that that needle is secured nicely, because it can come off that syringe. So you want to turn it and just make sure it's secured nicely onto the syringe. And we are typically going to be advised by the clinic how much liquid to draw up, but oftentimes with the HGH, what you'll be drawing up is 1 ml, 1 cc of liquid using this syringe. So I'll draw up to the 1 ml. So what I do with that is I'm drawing up an ml of air. I'm going to pull the cap off, take the vial that contains the water, the sterile water, and I'm just going to raise this so you can see me, but you could keep it on a nice flat surface. Put that needle in all the way through the rubber stopper, the center, turn it upside down, and you can inject a little bit of that air into the vial. If you forget this step, it's perfectly okay. I'm just equalizing any pressure in that vial by doing that little step. And then my next step is to just draw down. There may be some smaller bubbles there. That is perfectly okay. We are just mixing, we're not injecting. So right now bubbles are not an issue for us. But we're going to draw down, lining up that black rim of the plunger to the 1 line. So 1 ml. I might have some extra solution in here. If our clinic tells us to only draw up 1 ml and there's extra, you don't need the extra. You can discard that vial. And then you take that 1 ml and you're going to put that into the vial that contains the powder solution. Let that powder dissolve. It may be very cloudy at first, might be even a little bubble in there. Again, you can keep the needle in there and gently roll. You'll see where mine's a little cloudy here, and that's okay, because it's mixing the liquid with that powder. So we let it do its mixing. After it does the mixing, we're going to remove that needle, because that was just our mixing needle. We can then put this into our red sharps container. Oftentimes, like Mandel's Pharmacy, they will provide you with a sharps container to keep all your biohazards in. That's anything that's sharp, so we can put that safely in the biohazard container. Now, this one vial, often with HGH, will contain 2 injections. So if you are given 4 vials of medication with 4 vials of water, then just to break that down mathematically, you have 8 injections. If you're given 5 vials, there's 10 injections. If you're given 3 vials, there's 6. Again, the dosages that you need for your cycle will be determined by your healthcare clinic, and they will be able to order for you what you need. So once this has been mixed, I'm now going to use the injection needle and syringe to draw up my dose with my clinic's help and my nurse and my doctor's guidance with my dosage. So for the sake of today's demonstration, what you'll see here is this syringe is measured in units, and there's 100 units in the capacity of this syringe. What I'm going to have you draw up today is 50 units. That may very well be a very similar dosage that you might have that will be advising you to take with your medications. So we have you uncap that needle. Here you don't have to draw up any air. It's perfectly okay with this little needle to just go in through that vial once, okay? and you're going to draw up and pull down to that number 50. And even though that might look like you're drawing up a lot of medication, I just want you to know that with this syringe, even though it looks like a lot, it really is not, because the needle, or I should say the syringe, is rather thin. So it's not a lot of liquid amount that you're taking. So I'm drawing up to the 50 units. If your clinic tells you to take 54 units or whatever that may be, they'll advise you specifically, but this is around the range that you might be advised to take. There will still be medication in this syringe, in this vial. So what you will do is, this is the vial that you would now put into the refrigerator. And then when you take this medication again tomorrow night, you wouldn't have to do the mixing step. You'd be able to simply use your orange tip needle to draw up. So one bottle usually will make 2 dosages of the HGH for you. And so really you're not mixing every night, which is a bonus, but you're mixing one night for 2 doses, and then you'll mix again another vial, because you will usually be on this medication for, an average of anywhere from 6 nights to maybe 8 nights. So that's why you're going to have anywhere between 3 to 4 vials of the Omnitrope or HGH medication. So once that liquid amount is in your insulin syringe, now you're ready to do the injection. I've capped the needle just to keep it safe, so I can put this down for a minute, just to be able to show you guys where the injection areas are that you're going to use. I have a little mannequin here to just show us. It's easier for you guys to see that it's the lower belly below the belly button. And if you have your hip bones where you can feel that, in between those hip bones is where you want to keep the injection. And in this little area here, this is where we sometimes have a little fatty tissue that we're able to pinch. Upper abs tend to have some muscle there, so this is not a muscle shot. It only needs to be going into that area of fatty tissue. Your clinic may also advise you that you can use the thighs as another area. And so if you're using the thigh area, what we're focusing on here is upper thighs where there's not as much muscle, upper thigh area, and you could even use the side outer thigh area. So upper top thigh, upper side outer thigh, or belly. You can choose with this injection to be laying down and have somebody give you the shot. If they are administering the shot to you, the angle of the needle is going to go straight in. So if I were giving a shot to someone in their belly, I put the needle straight in this way. In the thigh, I go straight in this way if I'm at the top of the thigh. And if I'm doing the outer thigh, I go straight into their outer thigh this way. Okay, so it's a 90-degree angle, technically just straight in to make sure you get it into that fatty tissue. If you were to give yourself your own injection, you could sit as I am sitting in the chair, and the angle would be that I'm putting that needle straight into my belly. So I'd be giving the needle straight in this way into my belly. And if I'm doing my thighs are sitting, as this way with my belly up here. Once again, I'm going straight into the thigh and straight into that side outer thigh. The reason you just want that angle is just so you make sure that you get that into the area that you need to give that injection. One other thing that you do with this injection is, because it's fatty tissue, you want to give a little pinch. So I kind of show my arm here just to see that this is my fatty tissue. So I gently want to lift the fat on the belly or the leg and lift it up. I don't have to squeeze very hard because you could bruise with that. So it's just a gentle lift. That's how you prepare the injection area, is a gentle lift. You've got the angle. These are the areas that you can select from, and then you determine who might be giving the shot, if you're having the shot given to you, or if you'd like to self-inject. Today, what I'll just demonstrate to make it a little easier for the video is that I'll show you if you were giving your own injection in the belly. So what we would do is we select the area of the belly first that we're going to give it into, and we clean that area with a little cotton ball doused in alcohol. Our next little step would be to pinch that area. So hopefully, I want to just turn it slightly for you to see this. If I pinch that area of fat, I'm giving a little gentle pinch. I would then uncap the needle. And with that little pinch, what I do is I place the needle gently to the skin, 90 degree. I put the needle in. This is where I might feel a little mosquito bite pinch. That's very natural and normal to feel that, but it's very gentle, that little teeny pinch. Once that needle is in the skin, I let go of the fat, and then I just simply push on the plunger, and I don't have to go too fast or too slow. I just go in a nice steady motion in. And then once all of that is into the body, in the skin, I then gently pull that needle straight in, straight out. Put a little pressure there. And that will be where we just have a little droplet of blood, or what you might find is the medicine tries to make its way back out. So you want to keep it into the body there. So you just give it a nice little gentle pressure. Okay. And this would be your injection of the HGH. Once you are done with that syringe that you've just given a shot, you can leave the cap off and then put this gently right into your biohazard container to keep yourself and anyone in your family safe from any of those sharps. And as I noted, the vial that we did mix, we're going to put that in the fridge for tomorrow evening. Before we give the shot, we can take it out and set it down on the counter for about 5 minutes or so, just to let it warm up from that cold temperature. You can take it right out from the fridge, or you can let it warm up. Either way is fine. And then all you would need is one of those insulin syringes to draw up that dosage, because there'll be one dosage left. And then you'll administer the HGH. And it'll be that third night that you'll need to mix a new vial. So remember, you might be anywhere from 6 to 8 days of this, doing one injection daily. But again, the time of the dosage, how much you will take, and where you're going to inject, the clinic will also confirm this with you. But this video is a nice general way to see before you get started, or while you're beginning your cycle with this medication, how that medication is mixed and administered. So we do hope here at the Virtual Learning Experience with Mandel's Pharmacist Program that this was a helpful video for you. And from all of us here at the Virtual Learning Experience, we wish you all the very best with your fertility journey and your medication cycle. So HGH, not too bad. It's not in everybody's cycle. I think that's the biggest message, is it's selected, so it's dependent upon whether your body needs that. So,
and I feel it's relatively new considering all other drugs, comparing to other fertility drugs, or at least at our clinic. And it's been a couple of years, but still relatively new compared to other drugs as well. But kind of the first question that came in is, what is HGH doing, and what's the benefit of it?
Like I said, it is going to be a particular audience that might need that. Sometimes people that may have known diminished ovarian reserve, or possibly if they've done previous IVF cycles and maybe didn't have the best of maybe some poor embryo development. So the idea behind it for the patient that may benefit is really to improve the hormonal environment within the egg. So it's really, when you think about that, that's really just hopefully helping with quality. It's not going to necessarily increase quantity of eggs, but the goal is those that are able to recruit, the goal is hopefully it might boost that quality of that egg, which ultimately becomes an embryo. And then that's hopefully when we transfer an embryo back. So anything we can do for certain patients to give it everything we've got when they're stimulating in those cycles.
No, perfect. And then what are potential side effects from this medication? What are things patients should be aware of? Common side effects outside of kind of the norm?
With HGH, I mean, I think more frequently what I've read and what I see is that they've noted there could be some joint pain, increased alertness, sleeplessness, but because people are on, for our cycles, more lower dosages and not on it for a long term, it's somewhat rare, to be honest with you, to see some of those even more common side effects for our patients, just because of the fact that they're on lower dosages, much lower dosages, and not on it for very long.
No, I totally agree. I definitely think that I don't have very many patients complain at all something from that, because usually it's the other hormones that they have more side effects from.
Exactly.
And then, so HGH obviously is not a new medication. It's kind of more newer to fertility. And usually it's been made for, people have heard of it for muscle building. Do our patients have to be concerned about gaining weight or muscle with taking this medication?
I mean, again, I would reiterate what sort of it answered from the last question, is that, again, because our patients are not taking very high dosages of HGH, or they're on it for such a short period of time. I think it's one of those things that certainly can create that muscle building, muscle mass, but that's more for higher dosaging and also longer periods of time.
No, great. And then as far as storage, so I know after you said if there's medication left over in the vial, you obviously want to put it in the fridge. But what about before, when you get it from the pharmacy? Can it be left out? Does it need to stay in the fridge? Any recommendations on that?
Usually with your medications that are arriving to you often, as we have a couple that are even others that are powdered form medications, they can be at room temperature. So it's, again, what I always say is often the pharmacy will provide some of that, like protect from light, or, you might even see that with other medications that you get that are not fertility. So the idea is you can always look at the packaging from the pharmacy, which is why it's helpful to open up the medicines ahead of time. Or if it doesn't have that on the packaging or the little package from the pharmacy, the actual medication might even have it on there. But you can always ask our clinics. But really, for the powder, before you mix it, usually room temperature is good. And then once mixed, then that will be in a liquid form, which will only last for a couple doses. So then you would put that in the fridge, any remaining.
Perfect. Well, I don't think I have any other questions on this have come through. Anything else you want to say before I start our next video, which is going to be Ovidrel?
Yeah, I'll give you a few minutes to get that ready. The next medication, one of the next medications that we're going to review is similar to the HGH in terms of the injection technique. The injection technique that we often see with a lot of medicines is called subcutaneous. So it means that the needle is smaller and that's only going into the fatty tissue. So that's where it has a similarity to that HGH. Where it differs a little bit is this is something that actually comes, Ovidrel, this is a little box that I have from my little stash with teaching. And Ovidrel comes in a liquid form. It's ready to go. It actually is as if I've mixed it for you, put it in the syringe, and I'm handing you the syringe ready to inject. So sometimes that's a nice type of medication to have to work with, because for patients, it's a lot less preparation. It's really just uncapping the needle, maybe tapping a little bit if you see a little teensy air bubble, but even that's not life-threatening with the little subcutaneous injections. So what you'll see is that similarities are in the actual injection technique, but it's nice to see something that looks a little different that's ready to go, ready to mix. Just a preview of what Ovidrel is for. Ovidrel often is used as a trigger shot. So sometimes we hear that word trigger or ovulation injection. So Ovidrel can be used for some clinics. They use it for their IVF triggers. And some clinics use other HCG or whatever, or it can also for sure be used for intrauterine insemination. So when you're doing fertility and we need to then release and prepare the egg to meet up with sperm, whether it be insemination or IVF, in vitro fertilization, that ovulation is induced with an ovulation inducing medication, and Ovidrel falls in that category. So I don't want to give too much of it away, but we'll take a look. Morgan will bring up that video and then we'll come on back here for any further questions that you have after the video. The first medication that we're going to review for your fertility cycle is Ovidrel. Ovidrel is a medication that is used for ovulation. It either prepares you for possibly an egg retrieval, or it prepares you for an intrauterine insemination. And it just depends on which center and clinic you're working with as to which medication they use to help with that ovulation. But Ovidrel, just first off, just so you know what you're going to need, my biggest thing with Ovidrel or any of the medications in teaching is just to tell you what supplies you need before you get started. So just a little sheet here is letting you know that the supplies you need for Ovidrel is one pre-filled syringe of Ovidrel. It's nice and simple. That's only one item that you need. So to start out with this medication for ovulation is really easy for patients typically to use, and hopefully it'll be easy for you too. The nurse and me, the other part of this is very important that you know that doing a medication is not a sterile technique, but it is a clean technique. So once you get your box of Ovidrel and you're preparing yourself to prepare for the injection, what I want you to know is just go and wash your hands first, or if you have a little bit of bacteriostatic hand sanitizer, what I want you to know is just either way, it's just good to start off with clean hands, okay? This medication, like I said, is for ovulation, but the other thing that I want you to know about it is that it is a subcutaneous injection. which means it just goes into the fatty tissue, which is good because that's a small needle. And usually those are easier to sometimes tolerate for patients because they're a little bit easier to administer. And literally the pinch you feel is like a mosquito bite. So to give you something that you've already done, possibly to make this seem not so daunting, is if you've had blood drawn, you have done something more evasive than this injection. Little injections are a little pinch. That's literally all they are in the skin. So first off, when you open up your box of Ovidrel, what you're going to find in there is your syringe is going to be pre-filled, pre-dosed, ready to go. So as far as for patients go, this is one of the easier type of medications we could have you take for your fertility cycle because all you're doing is injecting. And we would always guide you at the center, your center, wherever you may be, with when you need to take it and what time, if there's any sort of time requirement for you with your center. So let me just open that. There we go. In the box is a syringe. You'll see it's pre-filled with liquid. That liquid is ready to inject. That's the medication. So simply, sometimes what you might see that people hear about is bubbles. And if you're worrying about any bubbles, you just give a little snap to the syringe and the air bubble rises to the top. I kind of I sometimes discourage sort of shooting liquid out because that is precious medicine to your cycle. So I don't want you to lose anything. So it's okay if you do a little bit of push with the syringe, but just be very, very careful if you do that. So I'm not going to uncap it yet because I want to show you where this injection goes. And with the help of my injection mannequin, what I want to show you is for this injection, typically you're going to use the lower abdomen, lower belly below the belly button. And when you take this, this is a one-time shot, so it can go anywhere in this belly. The other area to use are your upper thighs or outer thighs, because again, this is a fatty shot, so it just needs to get into that subcutaneous tissue. This injection can either be self-injected or you could have somebody give it to you. So what I'm going to do here is actually, if I were self-injecting and I was standing, and this is my body as the mannequin would be here, I just want you to see that the needle would go in at a 90-degree angle. The other part of this type of shot is that you pinch the skin just a little bit when you administer it because you want to make sure that you're getting into the fatty tissue. So first thing we do to that area is we clean it with alcohol. Just get a good little clean there. Next step we do is we can uncap the needle. Just be careful. Put that cap down. And here's where I said that if you did a gentle little push-up with the liquid, if it comes out, you can do that, but you want to gently push that up and create a little bubble, and that bubble or a little release of liquid, and that's fine. And then what we're going to do is we would pinch the skin in this belly, and we don't have to jab. Place the needle gently to the skin, insert the needle all the way, let go of the fatty pinch, push the medicine all the way in, count to 1, 2, 3, and then release and take out that syringe. And you can put a little cotton ball there. You might get a little bit of the fluid from the medication or possibly a little bit of bleeding that you could have as well, but that's fine. That's what you should notice. The bleeding would go away pretty quickly. So with this medication, what you want to know about the injection is it's very quick. It goes in quickly. It's a little pinch when it goes in. And Ovidrel doesn't typically sting. Some medications can, and we'll talk about that if we have any. But just for this medication particularly, it's not usual that you'll find that it stings. Hopefully this has helped you to see how to work with your Ovidrel medication. And I wish you the best of luck with your cycle.
Awesome. That was great. Definitely a good demonstration on how to do the Ovidrel injection. And just the first question that came in is, whenever you take the trigger, what is your window to take it? And if you miss that window, how long is too long past that? If that makes sense.
Good question. Good question. The trigger shot's always a little nerve-wracking. And if you're using Ovidrel as your trigger, specifically for IVF, which is in vitro fertilization for an egg retrieval, the timing is more specific because it's timing that trigger with a procedure that's under anesthesia. So oftentimes, most of the clinics will advise you of a specific time, your nursing team, and they'll give you very specific instructions if that trigger, again, is being connected to an egg retrieval, which is an anesthesia procedure. And there may not be as much wiggle room. So if you ever happen to run late or some issue does arise for you, as with our clinic, we have an on-call service. So you would want to page the on-call nurse and maybe just give her a heads up if something happened with your timing. Unless it's a drastic amount of time. Really, usually for us, I know at our clinic, it's on the hour, on every half hour. So somebody might have a shot at 9 p.m., 9:30, 10 o'clock, 10:30. So you kind of don't want to overlap with somebody else. That's the key in getting your own specific time and sort of taking it as directed. If it's for insemination, your clinic will usually give you a window of hours that you can take it. Again, usually in the evening with the injection, but again, your clinic's going to advise you, because with an insemination, that's not an anesthesia procedure. That's usually done in the office in the clinic. So oftentimes for that, you have a little more leeway, a little more window, I should say, and a little more range with the time of when to take your injection. So a little more flexibility with that.
Perfect. And then you said kind of earlier before the video what that Ovidrel is causing you to ovulate, that you might need for your IUI or IVF cycles. How is it actually causing you to ovulate? What's the function behind it? How is it making you ovulate? And how does it ensure that you ovulate?
So it's going to finish up that final maturation of the egg and help with the body in terms of releasing the LH hormone. So normally we have that luteinizing hormone, but the HCG sort of mimics that in the body when it's administered. So it's mimicking that LH function within our body to help release. The egg is within a follicular fluid sac. So when ovulation occurs, it sort of erupts, and that follicle then, that follicle which encapsulated the microscopic egg is then allowing for that egg to release. And that egg is going to then meet up with sperm, whether it be in a laboratory, or I should say in a lab. We're kind of catching you right before that follicle erupts, because we're manipulating the egg with the sperm in a petri dish. With regards to the actual ovulation of a insemination, it's going to be that egg is going to migrate into the fallopian tube, and that's where the sperm, when they do the intrauterine insemination, are going to meet up with that egg to fertilize. So it's just really helping with the function of that follicle and functioning with that LH that we normally have as a natural surge, and HCG helps to mimic that final maturation LH surge.
Perfect. And if for couples that are doing IUI cycles, when would they check for pregnancy typically after they take the Ovidrel shot, if they're doing intercourse or an IUI or anything like that?
Yeah. Usually when we're scheduling those appointments, what you'll see is that we will often have you come in, if you don't have a period, within about 14 to 16 days from that trigger shot. So that's what we usually will use as our timing for you, so that we know that if you by then have definitely not had any sort of bleed, or even if you've had spotting but it goes away, within 14 days usually of your trigger shot is when we would bring you in for that pregnancy test. If you've done an IVF cycle and you had a retrieval with a embryo put in at the very same cycle, kind of the same timing, is once again about 2 weeks or so from that ovulation, from that retrieval ovulation, that we would then have you be tested for pregnancy.
Okay, great. And the last question that came in is, what if a patient, she had one time where she actually tried to get that bubble out and she got nervous and squirted it all out, or half of it, and then she still gave herself the injection, but she was nervous that she didn't give herself enough. Is there a way to check to make sure the medication worked and to make sure that she did ovulate?
Mm-hmm. So usually if that were to happen, sometimes if a patient's coming in for often with an egg retrieval, after you take your HCG trigger shot, most clinics, I can only attest to from our own clinic, that we bring patients in the following day and we are able to check the HCG hormone to see that it's present in the blood. And that with that detection, that tells us that the patient got the correct amount. If there were ever where there was a question of how much they were seeing in the blood, and the patient mentioned she thought she missed some of that, sometimes they might do a little booster, like a little second dose of the trigger shot. Again, it doesn't really necessarily change the retrieval at that point, but it could be that they boosted a little bit. For insemination, usually it's not always checked the day of an insemination, but sometimes if there's a question like that where a patient lets us know they have an issue, we can add a blood work maybe and check there as well after they've taken their trigger. But we usually do check for, especially the inseminations, a couple days after that trigger shot, we will check after you've had insemination and we'll check your progesterone levels. And that kind of lets us know that indeed you ovulated, and then we see if there's any supplementation needed. So there's a lot of little different ways that your clinic can handle that if there's worry, but even within a cycle, it's part of a cycle to check some of these things to see that we confirm ovulation. Does she need any supplementation? And especially when we're preparing for egg retrievals, we will absolutely test that level to make sure you responded.
Perfect. Well, I think it's all the questions that I had come in. If you have anything else you want to add to that before we start this next video, which is Synera.
All right, sounds good. So as you can see, those two medications, although the presentation was different, one was mixing, which is nice to see the mixing medications, and one is prefilled syringe. Technique of administration is similar. So sometimes once you learn one technique, that can apply to many medications, and that can simplify things a bit with your fertility cycle. So that's what makes this even nice to see that with the two videos that we showed previously. One of the biggest things I know we as nurses, Morgan would agree to this as well, is that some people are really could be needle phobic and worried about having to do these injections, and that's okay, and certainly express that to your nursing team. We want to do whatever we can to not have that fear get in the way of you getting through a cycle. So we would want to do whatever possible to aid that process of conquering. Sometimes it's even, we can have you talk with some of the clinical psychologists who work with people with a phobia, and sometimes that's very helpful. They have nice little tricks of the trade. Or the other, one of the products that we're going to finish up with actually is a patch that is a numbing type of patch. And what that will do is if you're having maybe a subcutaneous injection or an intramuscular injection, sometimes even with the blood draw, you know, these are tips and tricks that we can do to help you get through the process. So Synera patch is a numbing type of patch that is applied beforehand in terms of wherever a needle is going to go into a surface of the skin. And I'm going to let you see that our video will go into it a little bit here where I'll talk about it so that you can kind of hear about it. And then if it's something that you feel that maybe for your cycle might be helpful for you in getting through these treatments, then by all means, you know, you can discuss with your healthcare professional, your clinic, your nursing team, and they can see what they can do to see if it's something that your insurance may cover, or if it's not covered, you might have to pay out of pocket, but it may still give you some comfort in moving forward with this injection cycle. So we can take a look at that video and come back with any questions that you have. Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn, and this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Synera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use, so you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, you know, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch, and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, I should say there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that mine have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspect, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle.
Awesome. So one of the first questions that came in was, so a lot of times Synera maybe not be covered by insurance, and they've heard that can be pretty pricey. Do you think it's worth that extra expense?
I mean, I think that's a good question, but it is sort of an individual one. So I guess that, there could be maybe something else. There's some other numbing creams that might be available that could potentially be covered. Some of the clinics, even ours as well, we've often said, a patient could put a little ice to an area, which obviously everybody has access to a little ice. It just really depends on the patient. I know it can be with any medications. I think like anything, there are times when some things maybe are not covered, or you might have a fair amount of a copay. But I think that you have to look at the value of what it's worth to you in helping you get through that cycle. And even though it may seem like a lot of expense, it really may not be ultimately in the scheme of the entire cycle that you're putting forth. And if it really does help you to feel comfortable, then I think it can be worth it for certainly a certain caliber of patient that really, really needs it, really might genuinely have a phobia, and that's getting in the way of them trying to move forward.
I think that's such a good point. There's a point that there can't really a price tag on your comfortability and getting used to it. I always tell my patients too, I think that there usually a coupon for your first box and to try it out. And if they like it, then great, we'll keep ordering it. If they feel they can, go without it, then that's great too.
Mm-hmm.
Is there a potential for overdosing on the patches? Let's say someone puts it on, they forget that it's on, and it's past that 30 minutes. Anything to be worried about that?
Actually, that's a good point. And they do, and Synera has tested by actually having the patches stay on longer and even sometimes putting on a double dose in some sort. So I know they've done a study with that. I think they doubled the timing, et cetera, and still found that there's no danger in it. It's not overly dangerous to do that if that were to have been the case where it's left on. I think the main thing to know with that, though, is that it is a numbing cream. So that skin is then numb. So you got to remember that you got to be very careful of exposing that skin to too much cold or to too much heat or scratching it. You may not feel. That's the big thing about anything with when people don't have their sensation of feeling, like putting their hand on a hot stove. If they can't feel that, that's a problem. So just know that it's been studied. It's not an issue. You would never want to panic if you forgot and you left it on 45 minutes or even an hour. It's okay. It's just that know that that area is now numb. So it just has to be handled with care with regards to any temperature or anything when you touch it, because you could really scratch hard and not realize you are damaging, the skin, and you could get it to bleed or something because you really don't feel that. So that's the key with that.
No, that makes complete sense. And then can you ever reuse the patches, or could you cut the patch in half and try to, use one patch for 2 different injections? What are your thoughts on that?
I wouldn't, I think that the thing is that we have to realize that when a company is putting together a product safety information, and they have probably done different things to test, that's one of those things that, I don't know that it's best to be going and actually snipping in between, because there is medication there, and now that could be open to air that could affect the effectiveness of it. So I think that because it is a lot of money and you want to get the best value out of it. But I like the idea, Morgan, like you said, that, if there is a coupon for that first box, give it a try. But then sometimes maybe once somebody tries a little shot without it and they say, okay, not too bad, or they get a little more comfortable with the blood draws, it may be that you could wean yourself. So I think foremost, we should, know that we should follow the instructions and the packaging, because the product makers have usually done some testing and it may change efficacy of the medication. So, it kind of can't hold something accountable if we're not following the way it's supposed to be used.
No, such a good point. I definitely think that we should always use our medications as how they're prescribed, and not try to tinker things because, they might not work as well, just like you said.
Yeah.
And then I think you kind of touched base on this, but is it okay to use the patches for sub-Q injections as well as IM injections?
It can be used. So obviously, even when blood draws are being done, that's a needle going really not even very far, because the veins are often at the surface of the skin. So you're usually going a little deeper with sub-Q. Veins, intravenous is right there a little more at the surface. Some people's veins are a little deeper though. But absolutely, it can be used for the intramuscular, the subcutaneous, and the blood draws. So it's helping kind of get to a person in all different areas that they might need that. I would say probably my experience with it might most often be patients usually manage the blood draws, and they even manage the little shots. Once in a while, it's tricky. The belly's very sensitive, I know. So sometimes we change up the injection area. But I think the biggest one is often with a muscle shot, because people they're just a little nervous, and there's a lot of anticipation and a lot of talking that they may have heard about that injection. But your clinics like mine and yours, Morgan, we also have other tips for that. So always just, say, hey, what tips might you guys have, like with your experience in this? It's a great way to get a rapport going with your nurse and get her to talk about what her experiences is with a lot of patients. Remember, we have a lot of patients, a lot of experience. We see what works, sometimes what doesn't. And sometimes something works for one person, doesn't work for another. But I'm always open with sharing it all both ways or little tips, because I feel like anybody might get a benefit. And if one person gets a benefit, but even if others don't, that's okay. That's what we're here for.
No, I love that. I definitely tell my patients, whether you ask me 100 questions, anything, then not ask me at all. And yeah, we've been doing this for a while, and we definitely have tips and tricks. And I always think it is important to come to us. And even when you, especially patients, when they have their friends or families going through it, if they hear anything, just always run it by your nurse first, because there's so many things that can be out there, and that maybe not be beneficial. But I think you made a good point. We definitely want that rapport with our patients, to help any way that we can, because we might have something, that little tidbit that can help, if not the patches. Okay, that's all the questions that I have. Anything else you can add to that before I kind of close this out?
What I'll just add is I was looking up some things about stress, because I think we all get asked as nurses, does stress cause infertility? And I always say that it's how we respond to stress instead of reacting to stress. So kind of think about that, response versus react. Okay, react tends to bring with it a lot of emotion, and response can bring emotion. Sometimes we're also using our head a little bit, and we're thinking a little bit more clearly. So I just wanted to say that in looking at this and reading some things lately, and with the holidays coming up and going through fertility cycles, the one thing you have with you at all times is your breath. And if you can commit to practicing and doing a little breath work, and all that means is sometimes just taking 5 minutes to sit up straight and tall. You could even place a hand here in the center of your sternum, which is your heart. And you can even place on the lower belly the other hand. And one little breath that I like is the 4-7-8. And it's just taking a nice breath in through your nose for the count of 4, sending that breath down to the hand that's on that lower belly. So it would be kind of like and you can close your eyes and do that and count. And then you're going to hold it for 7. And then you release it with a count of 8. And if you can do that for just even 3 little cycles, literally that's less than 5 minutes. But if you want to do that for a couple times, and then just slow down. We often say, I need to take a breath. How do we hear that when we're like, oh my gosh, I need to take a breath. So it's very interesting that we use these things, or I need to follow my heart. So if you're placing your hand on your heart and you're working with that lower belly and the breath, it's kind of harmonizing everything. So I think we all can use it at this time. Morgan and I can use it right before we do these videos. So just so you all know, we all experience it. Nurses do, the doctors do, your team does, the pharmacy does. And for you guys, we want to just share with you guys that that's something that is with you, is your breath at all times. And it's a practice. So like anything, think of it like a sport, a team that has to practice. Think of it like when you play an instrument, you have to practice. So the more you do of it, it's almost like you're able to self-regulate more easily at times of stress. And fertility can be stressful. So sometimes if you need to sit in that waiting room quick and take a little breath, or in your car right now with COVID, where we kind of have you being safe before you come up, use that as your 5 minutes, especially for the ladies when you're coming in for that morning monitoring and you're starting that process in your day. It might be nice to take that 5 minutes of a nice just 4-7-8, a nice inhale, exhale, release.
No, I love that. I literally just did that whenever you were saying that, and you automatically feel better. And also loved, everyone has stress, but it's like how you respond and react to that is huge. So that's super helpful. Well, thank you, Wanda. You're so amazing. You're just a wealth of knowledge and information. You answered all those questions so flawlessly. So thank you so much. And thank you everyone who joined us via Zoom or Facebook. I just want to remind everyone that, just like Wanda spoke earlier in the video, is that we do offer all these videos demonstration on these medications are available on Mandel's Facebook page, YouTube, or at mymandelsPharmacy.com/pharmacist. We have these videos from tonight, as well as all the other videos from other medication instructions that we've done throughout the year. Also, just a reminder that we do these every Monday at 7 p.m. Eastern Standard Time. So if you didn't catch any of your medications that you're wanting this week, please join us for next week, because we do 3 new medications, usually every week. Please also share this with your family or friends or anyone you know that's going through fertility. We love the questions, and we are here for you. And we hope everyone has a great rest of your evening, and happy holidays. Thanks so much,
Thanks,
everyone.
Morgan. You're a great hostess. Appreciate it. Bye, everybody. Good night.